Today I have an order from the doctor for my new patient that goes by the name of Ivy Armstrong. She has just been admitted to the med-surg unit for a urinary tract obstruction. I was ordered by the doctor to insert a Foley catheter for urine retention, as well as obtain a urine culture. And then another thing is she's been put on strict INOs, and then they want output every hour. So first, I'm just gonna make sure that I have all of my materials. So since this is a sterile procedure, I would make sure that I have an extra pair of sterile gloves. One comes along in my kit. Make sure that I have a kit that hasn't been open or have any holes or anything in it. I would first do my first med check at the Pyxis. I would make sure that I'm getting the right order for Ivy Armstrong, make sure that I am administering the action now. I would make sure that I have the right meds, which is catheter. The right route is by urethra, and the effect is for urinary retention. And then I would then proceed to go into my patient's room. So,
come in.
Well, hi Ivy, how are you?
I'm good. How are you?
I'm good. My name is Veronda. I'm going to be your nurse today.
Okay.
First, Ivy, what I'm going to have you do is verify your name and date of birth for me.
I'm Ivy Armstrong, May 24th, 2001.
Okay, great. Ivy, do you have any existing allergies that I need to be aware of?
I'm allergic to latex.
Latex? Okay, well, I don't think I'll be using anything containing latex today.
Okay.
At that time, I would just double check, make sure that I don't have any materials containing any latex.
Okay.
Ivy, are you experiencing any pain at the moment?
No.
No pain? Okay, good. Well, Ivy, at this time, I'm going to raise your bed to a working height for me.
Okay.
Today, I'm going to be inserting a indwelling catheter for you just to help with some urinary retention because I see you're holding on to a lot of urine right now.
Okay.
Okay. That's about good. All right, Ivy. So I'm going to provide you some protection because what we're going to be doing, we're going to be pretty exposed today, okay?
Okay, thank you.
All right. All right, Ivy, for starters, I'm going to be lifting your covers up at the bottom just a little bit, okay?
Okay.
I'm going to work my way up. I'm not going to raise them all the way up. I'm just going to work my way up, okay?
Okay.
For starters, Ivy, I'm going to need for you to move your legs in a froggy-like position just for a little while, okay?
Okay, thank you.
Okay. Lift that leg, lift that leg. Okay, good. All right, Ivy. I have what's called this leg band. This is just gonna help your catheter to stay in place once we assemble it and get it inserted, okay?
Okay.
Okay. So, you'll just attach it like this. Sit right here on the patient's thigh. Okay, at this point in time, I will then get my kit, everything together and ready.
Okay.
Don't mind my kit, it's kind of raggedy looking. Open it, we're gonna pretend like this is like brand new. All right, Ivy, I'm gonna use my little plastic here as my trash bag, okay?
Okay.
Is it okay if I set this up there by you?
Of course.
Okay. Here. All right, Ivy, so before we go ahead and get the ball rolling, I'm gonna need for you to let me know if you need me to, clean your peri area for you, or do you think that you can do it all on your own?
I can do it.
You can do it? Okay, great. So while you're, getting your clean on down there, I'm just gonna go ahead and start to assemble some of my equipment, okay?
Okay.
Okay. So at this point, we would try to start getting everything that we're going to be using hooked up. So in this sense, we could start to hook up our sterile water, get our lube and everything all, you know, prepped and ready. So that way, once we start to insert it, we don't have to be manipulating a lot of things so much. Okay, that should be good. Toss that in the trash right there. All right, Ivy, so at this time, I'm going to start my sterile field. So I'm just gonna lay out my next sterile drape, okay?
Okay.
Now, I am going to go ahead and put on my sterile gloves.
Sounds good.
How you doing, Ivy? You okay?
Yeah. How are you?
I'm good. I'm good. You been liking the weather that we've been having?
Yeah, it's been a little cold.
Yeah, it has been pretty cold. Okay. So first, we would then once we're proceeding to put our second one on, make sure we're not putting our thumb in there. At this time, we'll be doing any adjusting that we would need to make sure they're all nice and good. Gonna throw these items away. All right, Ivy, can you lift your hips a little bit for me?
Yes.
Just gonna make sure this is positioned under you good, okay? All right, Ivy. At this time, I'm going to clean your skin, okay?
Okay.
So, you know, we would pour our iodine, make sure we have our iodine and all that ready. So, first, we would start with our outer lip lesion, so we would go up, down, trash. Do this side, trash. And we would hold this open. We will go right down the middle. Trash. Okay. At this point, we are now going to go ahead and insert. Okay, Ivy, on the count of 3, I'm gonna need for you to bear down a little for me, okay?
Okay.
All right. 1, 2, 3. Okay.
Did I do good?
Yeah, you did really good. So now we can go ahead. Have our waters. That's trash. All right. So Ivy, at this time I'm gonna go ahead, give it a little tug, just to make sure that it's nice and in place. It's pretty good. I'm now going to do glue to glue and make sure that I've secured my catheter. Okay. After that, I'm then going to put this onto the bed on a non-movable part. And that will be it. All right, Ivy, so I still have to grab a urine sample from you, okay? at this point, we'll then make sure we have our specimen cup as well as label. I'm gonna go ahead and take these gloves off because I have been touching a lot of different things. For hand hygiene. Grab some more gloves. All right. Okay, Ivy. So for starters, I am going to grab my syringe. Make sure my specimen container is nice and ready. I'm gonna set that right there. I'm gonna set this cap on your leg, okay?
Okay.
So, first, for starters, we've got to kink our tubing just to make sure that we're making that urine stop. That way the sample that we get is nice and clean.
Thanks for explaining.
Yeah, of course. Go ahead. Yep. Grab an alcohol swab. Wipe for at least 30 seconds. 28, 29, 30. All right, I'm gonna pull some urine back. All right, untwist that. I'm gonna put it in my container. Good. I'm then gonna get my label all set and ready. So I'm gonna make sure I'm labeling it with my patient's name, patient's room number, the date, the time, and making sure that I send this down to lab, okay? I'm gonna set this to the side while we get everything nice and cleaned up. We're gonna make sure that our patient's catheter is locked back in place. We're also going to make sure that we unkink it to make sure that the urine is starting to come back through. All right. All right, Ivy, how are you feeling?
Good.
Okay, so now this time I'm all done. I've got my sample. I did everything that I needed to do. So if you feel any discomfort from your catheter or anything, you just let me know, okay? I'm gonna go ahead and let you lay your legs back down. I know your legs are probably hurting by now, huh?
Yeah.
All right. Lay those back down. Pull your gown back down. Go ahead and remove these items. Toss those in the trash. Cover your back up. And as I am proceeding with everything, making sure you're nice and covered, Ivy, make sure that you have your call light in your hand, which you do. At this time, I'm gonna remove these gloves. I'm gonna go over to the MAR and document what I just did. And then Ivy, are you okay at the moment? Do you need anything?
No.
No? Okay, I am then going to go ahead and raise my bed back down. Okay, I'm going to make sure that my patient's bed is locked. So at the moment it's locked. I just unlocked this, so I'm going to make sure that I lock it. All right, nice and locked. She has her call light. Her catheter, where her Foley catheter is on a non-movable part of the bed that isn't one of her bed rails, so she's nice and good. And before I leave my room, I would then wipe down any surfaces that I've just used, gather up any extra materials as well as my specimen container, and then I would proceed to leave out of my patient's room.